John, Time magazine named Lumaflex one of the best inventions of the year. What problem were you solving that made it stand out on a global stage?
So we're doing portable, localized, targeted red light therapy. So red light therapy is now everywhere in the world. It's big in beauty. It's been known for wound healing. It's used in medical. There's studies now to support eye health and even mouth health for even for your nose, for your sinuses. It's the studies for red light therapy are overwhelming. But if you look at the studies and the devices, the sort of the contraptions that they're used in these clinical settings, they're actually more localized treatments that bring about these clinical studies. So panels, red light therapy, beds, far infrared saunas. This is something that's been on the market for a long time. Athletes use it for recovery and for overall well-being. Brian Johnson raves about it all the time. But there wasn't really a product that was localized. If you look at Therabody, what did they do? They got massage therapy and they allowed it to be portable, versatile, in everyone's pocket, use on the go anytime. And this wasn't really done with red light therapy. And I came into red light therapy from personal pain, from playing rugby. I injured both my shoulders and my left knee. I got into boxing. I was fighting in amateurs for 4 years and then started to have very severe headaches. My wife pushed me to go do a check, and I found I had a tumor in my head from just trauma to the brain, just getting hit in the head. And that was sort of a bit of a wake up call to change my whole sort of the way that I was living and go into more medical, go into wellness. But red light therapy,
Mm.
she pushed me to do, and the device that she had me used was very cumbersome. It was something that wasn't very versatile. It was a large lamp, something that you would have by your desk, but it worked. And I wanted to create something that was as powerful, as effective, but would be easy to use. You could throw it into your gym bag. The actual concept was, they do these videos on YouTube where they get a famous athlete and they're like, "What's in your gym bag?" And they
Mm.
products, and I was like, "You should have a red light therapy product in that gym bag." So the first one that Time Magazine kind of were known for, we actually have 11 awards, by the way,
That's
more
fantastic.
more awards
Wow.
than any other company in the world now for design and
Wow.
innovation. So this is the one, the Body Pro. This is the one that we're most known for. And I have a friend who served in the British military, Levi Webb, and he was cleaning a gun when he was in the military, and a gun fell on his back, and he got very severe sciatica. And I kind of had this idea to integrate red light therapy into the military. So what that meant was to create a very durable device. You could put it in the sand, could put it in the snow, you could get dirt on it. And this one, the Body Pro, is IP67. And this year we're launching IP69. So that means fully waterproof. It can go underwater. But that was sort of the idea, is this like highly versatile, Red Bull kind of extreme red light therapy product, that athletes could take anywhere. And then it kind of just grew and grew, and then we started launching other products. But yeah, it's been it'll be almost, yeah, we're about 2.5 years launched, but the development of Lumaflex was like 3 years. COVID was a big obstacle that we had to overcome during that development phase, but we're still pretty young as a company, but
Mm.
exciting times, really good.
Yeah, very exciting, John. And for listeners that are unfamiliar with red light therapy, can you break down the science?
Yes, yes, absolutely. The demystifying red light therapy is kind of that's sort of everyone in photobiomodulation being the medical term for red light therapy. Everyone who is pushing or advocating or creating a product in photobiomodulation really the task is demystifying all the science, what it is, right? And how it was explained to me those years ago by a scientist was kind of what flipped the switch and got me really excited about it and got me into the, in deep into product development. But it's red light therapy, anything light therapy is cellular health. It's addressing a condition on a cellular level. That's sort of the first trigger that made sense to me is when we deal with inflammation, if you're like for me, boxing, you're getting hit in the head, or when you're training and you've done leg day and your body is sore, that's inflammation. And when you're dealing with inflammation, you can deal with it on a surface level. You can do massage, like you can use or compression. And this is all good and it's very effective. But it's far more effective to deal with inflammation on a cellular level, to boost the health of your mitochondria to then recover and to perform better. So light therapy, basically light passes the pain barrier. These specific nanometers pass the pain barrier and activate your mitochondria. And they provide ATP energy, increased cellular energy, increased blood circulation, and a reduction in inflammation. So with those three mechanisms, we're basically optimizing the cell to do what it's supposed to do. So it's not the light that heals you. It's not the light that does the magic. It's actually the light giving energy to your cells to do the
Mm.
magic. So
Wow.
this is where you get studies on hair growth, where you get like I said, for eyes. Joe Rogan, I think he talks about this in an episode, one of those episodes. He actually stares at red light therapy for 3 minutes a day, and he said he hasn't needed to use eyeglasses. So it actually can help your eyes to, if you're having trouble, with farsighted or you're nearsighted. Um,
Mm.
we go off into beauty and boosting collagen, and creating more healthy, skin that goes into longevity, where Brian Johnson talks about it, how he's trying to actually bring down his his biological age and live longer. I mean, his goal is to live forever.
Yep.
So in order to do that, in order to achieve longer life and a long, healthy life where you don't just survive, but you thrive, you need healthy
Mm.
cells. And that's
Yeah.
what light therapy does, if that
Yeah.
makes sense.
Yes.
Mhm.
And what does the clinical research say about red light therapy in regards to muscle recovery, inflammation, and even, I guess, certain diseases?
Yeah, the clinical research, what I'll do is after this call, I'll send you a link that I have access to, and it's the global database for red light therapy studies. So the global database being every single study that is now available, and it's always updating. It's always new studies are being put into this database. And the database now, I think we're close to 9,000 studies. I think the last time I checked the number was 8,800 something studies. And the best way to use this database is you control F because it's on an Excel. You type, arthritis, or you type, sports injury, and you'll be directed to the studies. And when it comes to sports recovery, when it comes to rehab, it's the battle has actually been won a long time ago. Where we're going
Mm.
now with red light therapy is brain health. That's the more
Wow.
interesting space of light therapy that's
Mm.
exciting, to show that light, just specific nanometers of light, can actually help with dementia, with Parkinson's, with autism, with Alzheimer's. There's a study I can send you that we is referenced a lot when it comes to brain health. And it's an amazing, it's sort of a summary of a collection of many studies about how and remember, red light therapy, it's just from the sun. It's all available to us in our natural environment, but there's certain specific wavelengths that we need in order to help with specific conditions. So if for pain management, for recovery, right, for an athlete that is injured, you're looking for, a red light, being in the 600 nanometer range. And then you're looking for near infrared light, which is the 800s to 900s up to 1,000 nanometer range. So the device I've got, I specifically am addressing pain. I'm not interested
Mm,
in creating devices for beauty or for these other outcomes. It's as an athlete, I wanted a device for athletes. So I've got 630 nanometers in the Body Pro, this device. So that goes about an inch into your body. And then I've got 850 nanometer wavelength, which goes about 4 inches. So different nanometers basically mean different depths into the body. That's for our understanding as, as users, as consumers, that's pretty much all you need to understand with the different wavelengths. It means different depths of
mm.
the body.
Can red light therapy at all stimulate, I guess, bodybuilding with regards to muscle hypertrophy? Like, is there science that um,
Yes.
looks
Yes.
at even for performance enhancement and things like
Yes.
that?
Yeah, that is the next wave of interest on the consumer market that's coming, I think, next year. Next
Mm,
year, like towards the end of this year and next year, I think we're still going to be talking a lot about brain health this year, but going into next year, where red light therapy will get a lot of interest is not just for recovery, but used as an enhancement, used as a performance enhancer. Kind of like there's one study, I think it was done in 2016. This is a link I'll send you as well. You can put it in the podcasts. And basically the study summarizes and said, due to the overwhelming evidence of red light therapy in competitive sports, we probably should look to regulation of of
mm,
of red light therapy. Because if you have team A and team B, team A using red light therapy pre-game and team B is not, on a cellular level, they have a significant advantage. And it will get
wow.
where people will know exactly their bodies and how to optimize for a game so that they can get their light therapy before and then enter the game. And they understand on a cellular level their optimal.
Mm,
So it really changes the conversation when you have a study, basically a scientific community saying we 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 would highly recommend that there's regulation in future competitive sports because this is something you'd want to address. If
mm,
team B and team A is using it and team B is not, that's going to show in their performance. If you have
yes.
Miami Heat versus the Boston Celtics and the Miami Heat are all, kitted out with, red light therapy beds, and they're all in the players lounge, doing red light therapy pre-game, it would make sense. Yeah, these guys, if on the level of competitive sports where everyone's looking for an edge, right? Just a little bit of an edge, that can be the edge. That could be the thing that turns the tide. But another study I'll definitely send you, along with many other ones relating directly to sports, because
Yes,
also with sports, red light therapy, because of how our circadian rhythm, right? The whole, we're kind of out of whack now.
we are.
Sunrise and sunset. This is something that we're not the evolution that we're in right now. We're not where we are. We're kind of looking at our phones during the night, and we're kind of messing up our sleep schedule. And
Mm,
red light therapy can help with this, using light therapy when the sun goes down instead of using artificial light, which is actually clinically proven to increase inflammation. You optimize sleep. Optimizing sleep optimizes performance. So that's another whole area where, you are just addressing your circadian rhythm, optimizing sleep, and then the output is better performance in sport. That's another whole collection of studies that are definitely worth mentioning. It's just,
wow, that is fucking fascinating.
yeah, it's amazing.
That
It's
is
amazing. It's incredible.
wow. Yeah. And you're right too, John. We are in a sleep deprived society. And also, depending on where you live in the world, some people don't get enough sunshine. Can red
Yes.
light also be a alternative if they are in certain parts of the world where there's not enough sun?
Yes, like I don't want to say that you only need red and infrared light. Like UV light for testosterone production and for overall health and well-being is still extremely important. Like there are devices that you can buy that are just UV light therapy. They don't even
Mm.
do any red and infrared light. And those devices are you like 30 degrees away from the equator. There's not much sunlight. And in those regions, in Europe, there people need their UV light as well. So I would say if you definitely if you don't have access to much sunlight, you need the healing nanometers of red and near infrared. But I would always encourage to also get a UV light device as well. Like in Miami, I've got a UV light that I actually first thing I do, wake up in the morning, I go and I put it straight on my balls. Like that's the and then you just stand there that and it's there's the studies on UV light is the thing about UV light is there's a dosage. There's a certain amount of dosage that you have to regulate. Just like when you go
Mm.
out into a very hot sunny day. Like my mom lives in Perth and she's telling me like the UV rating's like 18 sometimes. And she,
Yeah.
oh, I'm scared of the light. I don't want to get out there. And I said, you still need to get your UV light. Your dosage just needs to come down. So you maybe are doing 10 minutes, or 15 minutes max, depending on the UV rating. But you do need both. Sunlight is still
Yeah.
the optimal. It's still, the ultimate way to get your sun exposure is definitely from the sun itself. But if you can't, you got to hack it, right? You have to grab devices and use devices that give you that daily dose. It's daily. Everything is daily. Like you don't. It's red light therapy is not something you do once or twice a day. You don't.
Mm.
You
Yep.
absolutely not. The studies show that someone who is using red light therapy consistently recovers and is back in the gym, back in training, back on the field faster than someone who just starts using red light therapy. And if those two people had the same injury, the one using red light therapy is going to recover faster than the other.
Yeah.
So that's an important point is consistency. We are
Wow.
bodies, we're creatures of light born under the light. And we would always have sun exposure. This is part of, our ancient history that now everyone's waking up to. And it's not like something that like, oh, when I'm injured, I'll have red light therapy. No,
Yes.
you should aim it at your heart. You should aim it at your spine, the back of your head, your gut for gut health, right? Your face. These are things you need every single day because you don't just want to, address a problem when you have it. You want to prevent. It's that pre-care that you want,
Mm.
right? Preventing injury and strengthening your overall body and your cells, for whatever comes in your life, right?
Yes. John, we've dumped thousands of chemicals since World
Yes.
War II, and men's testosterone, mate, is just plummeting.
Yes.
What have
Yes.
you come to learn about the research on how red light could possibly stimulate testosterone production and other hormones?
Yes. I think where red light therapy and testosterone production, I think when that craze like kicked off, I remember it was quite a number of years ago, a guy by the name of Ben Greenfield, he
Mm.
did like a self-experiment. And it got published, I believe it was like Men's Health. I think if you look up Men's Health, red light therapy, Ben Greenfield, you'll see this article where he basically showed how red light therapy can improve men's testosterone. And that's where devices that was another sort of jump in the red light therapy industry where people were buying it, for testosterone production. The Body Probe being fully waterproof, you can clean it. I put this on my balls every single night without fail. Like, and I have like fertility clinics in Miami that buy it to help to support men, if the couple wants to have a baby and
Mhm.
something that they can clean. So that is something like, these, you know, these, these wild stories of these sun worshipers back in the day where they would go and prostrate themselves to the sun and everyone was like, oh, you're a wacky hippie, like, and now these guys, these scientists, free thinkers, whatever you want to call them. They're all given like red carpet treatment at these big
Mm.
events to actually then, because now this clinical research is all coming forward, and the overwhelming amount of clinical research basically is setting in stone red light therapy works. It's effective. You need it for recovery. You need it for injuries. You need it for optimization. You need it for better sleep. You need it for skin rejuvenation. You need it for longevity. It's all sort of set in stone now. And now these sun worshipers, these wacky hippies, they're all like the gurus, right? they're they're like they're, they're the ones everyone's trying to meet and trying to get on their podcasts and get them to come to their expos. And it's great. It's all wonderful. It's just now the information is more packaged. It's better. A lot of clinical research behind it. So then it goes now to the devices. Which devices are best for which use case?
Mm.
And obviously now, because there's a huge explosion, everyone's making a device. So then it comes down to, okay, what's the dose? What's the power output? What are the medical licenses that you have behind it? What's sort of that is now the phase we're in with red light therapy, because it's such a big trend. Everyone's trying to make it. And yes, you can make a device that's very cheap, but usually it's, the materials, that's another whole discussion, but I would recommend anytime you get a device, make sure it has the medical licenses, they have a protocol. And then something that is important is having the device match what is on the clinical research. So this is the clinical research. These are the devices that were used, and how do these match to what's being created as a brand, as a product? Um,
Mm.
Definitely. No, there's so much to share on this. On product development alone, that's another whole rabbit hole to go down.
I'm completely fascinated. I'm very interested, John. And I read something as well. Ambulances in Poland are choosing
Yes,
your product too. Can you
yes.
talk a little bit about that as well?
Yeah, I have so we distribute in 19 countries outside the US, and my Polish distributor has a very strong medical background. And so he's been in medical for a long time, knows a lot of hospitals, and he has a great relationship with the ambulance and the ambulance organization. So what they'll use it for in an ambulance is when, say, for example, there's a car accident and the person's in shock, and they can't be touched. They need to calm down before they can be moved, and they'll aim it on their face to calm them down. And it's usually for to support an area that needs, that is in pain, but they can't touch that area. It's sensitive, and usually it's with, someone's had a very nasty fall, an accident or something, and they're in a state where they're not only in shock, but they're in extreme pain. So when the ambulance first get on scene, they'll use the device to calm the person down, to regulate them. Then they'll use other modalities and that to be able to get them into the ambulance and to the hospital.
Mm.
But really, it was, I mean, all credit to Piotr, my Polish distributor. It's just so exciting to see a product that you've developed from pain, from all this passion, and and it's a dream, right? You're like, wow, I want to change the world. But then you see, wow, it's in an ambulance. It's right on the front lines of healthcare. It's just really, yeah, it's cool. It's something that I smile about, and I feel very proud to have a great relationship with my Poland distributor with
Yeah.
the medical community there. It really
Yes.
it means a lot, right? Because it's a lot of grind, right? And we're
Yes.
running
Yeah.
companies, and that's what you hope for, is like getting right to the front line to where the product's making a big impact. In Italy, my distributor Gianni, he is very credible medical doctor over there as well, and he's using the device now in a clinical trial for autism. And
Wow.
he's showed me like some of these autistic patients that he has. When they're left alone with the device, they'll actually bite it. Like, they're very serious autism patients that need to have like very, very special care, constant monitoring, and the device. And when I see it there, of course, it's my heart goes out to these mothers and fathers who have kids that have these, that have serious autism. But I'm just very happy that there's a device that like can actually be in that environment, do some good impact, and hopefully really change things around for these autistic patients. It's an
Yeah.
exciting year. It's really an exciting year. This is sort of the year that Lumaflex, because of these clinical studies, the medical impact that we're making, it's a time now where it's crazy busy. I'm always traveling. I've got to go. I got to fly to Thailand in a couple of days. I'm just jumping around a lot, but it's good, right? Because things are moving, things are happening, right?
Yes. And you did mention as well, John, with regards to Alzheimer and dementia patients, what
Yeah, yeah.
about people with certain mental health disorders, schizophrenia, depression, anxiety,
Yes.
bipolar, or even PTSD, like war
Yes.
veterans, have come back from war?
Yes, there's a veterans wellness center in Boca Raton. It's like 40 minutes from Miami that we sponsor units for. And that's what they deal with. Their focus is people with these mental disorders, with PTSD, with serious trauma. And there is a study, because when I look for studies, there's a lot of studies on PTSD and red light. There's tremendous amount. But what we're looking for is not just the specific nanometers, but the specific frequency at which the light emanates out. So something I did with these are the two Pro devices, Essential Pro and Body Pro. So I created an app with the device to where you can actually adjust the hertz. So you've got these different nanometers, and now pulsing them at certain frequencies. This again relates to studies where there's one, I believe if I'm remembering the study correctly, it's 50 hertz. So I have like the app like this, right? And it goes up to 100 hertz. So I can actually slide the bar and I can take it all the way to 50 hertz. And for PTSD treatment, this is what it'll pulse. You can barely tell it's pulsing, but
Yep.
when it comes to mental well-being, it's all down. That second layer of very accurate treatment is the light actually pulsing at a very specific hertz. And I think the majority of the clinical research is at 50 hertz. So yes, you can address these mental problems. And it's down, and where this comes from is in our sort of early history, right? In our ancient history, the sun would set, and then we would build campfires, and that flickering of campfires. Have you noticed where, like when you see a campfire, you're drawn to it. It
Yes.
relaxes you. It creates
Yep.
a feeling of like community. We gather around the campfire. It's warm, and it's all from, our early ancestry as, as primal human beings, where the sun would set, we would keep off the wild animals, and we'd build a campfire to create our safe space. So this flickering of the can of fire is actually what calms us. And that is how it relates to the pulse frequency. So when you have like the light pulsing, you put it at the back of your neck, or you put it on the top of your head, or you close your eyes and you put it on right on your face. And this pulsing it all relates back to how we would calm ourselves, how we regulate our emotions, how we would recover from perhaps, fighting a battle, or, fending off some wild animal, where we'd gather in the campfire. That's where we'd all, we would eat,
Mm.
and we would come, and then we'd go to bed. So it's interesting how everything kind of does track back to our early history, our relationship with light, our relationship with red and infrared light, our circadian rhythm, our general practices as humans, and how it's changed over time. And being in the digital age now, if you can acknowledge that and understand it, that's basically what biohacking is. The meaning of biohacking is old remedies that were done in those past times, brought to the future and used in devices or protocols, right? That's pretty much what it is. Like fasting is another one. I had a conversation yesterday with someone about fasting. And fasting, people go, wow, it's so amazing. It can like cure all these, very serious diseases. Like people get cured of cancer from fasting. But all that was just us not being able to constantly eat. In ancient times, we would have one big meal and then we'd have to fast and then, tell all the men in the group would be like, well, we got to go hunt. And that may take, a couple days where we'd have to track some wild, wildebeest or something, then bring it back. And during that time, we wouldn't eat. It's just if you think about it, it was just normal for us back then. But now it's a
Mm.
fasting. It's,
Yeah. Yeah. And you're right. You're right too, John. From an evolutionary perspective, that's how we would have evolved. That's
yes,
it's interesting. I mean, we don't really take it back to basics, do we, as a society?
yes,
Uh,
yes,
I was a PT before I sort of started doing all my other things on the side, and I used to say to my clients, if it falls off a tree, grows in the ground, walks the
yes.
earth, or lives in the ocean, it's the kind of food you want to be eating. And it's
That's right.
kind of pretty amazing now that the research and the science is now backing it up with regards to things like light therapy and that sort of stuff.
Yes, that's right. I even heard some lady say, very, very credible scientist said, if you don't eat it, don't put it on your skin. And I was like, wow, that's such a high level of being completely natural, zero toxins into my body. There's
Mm.
because how much different things do we put on skin? How like women's makeup or lotions or all of that. And she's like, if you're not going to eat it, don't put it on your skin. There's a little challenge for you. Like, okay, wow, I have to really anything that I would need for any kind of skin, I'd have to make sure that, where the product I'm buying, it's actually all like 100% natural ingredients. Because
Yeah.
I'm much against sunscreen. Sunscreen
Mm.
putting a toxin on your body that's completely like it's like what is in the sunscreen, like it depending of course on what sunscreen you get, but you're basically burning this toxin into your body. And then we're complaining about skin cancer, where it's like we didn't have sunscreen, in our ancient history, and it's not like the sun was always the sun. So I'm of that community that believe that sunblock is like, don't go near it, don't touch it, just regulate the time that you spend in the sun. Don't stay out too long. But that's like, yeah, that's another whole can of worms that we can the
Yeah.
conspiracy.
Yeah, that's a tricky one, John, too, because in Australia, we obviously have hundreds of thousands of people come from all different parts of the world, and our
Yes.
UV rays are extremely strong over here. And
Yes. Yes.
obviously, skin cancer is a part of Australian culture. How
Yes.
does someone mitigate that?
Yeah.
That's kind of a double edged sword, isn't it?
That's right. I would say like I'll tell you, there's a kind of fabric that you can buy. It's a special red silk. I found where to get. I found the manufacturer, and it's something that I want to add into the device. When you buy it, you get like this. It's like this silk fabric towel. And what this fabric does is it lets in all of the red and infrared light and blocks all the UV light. So in a sense, it's actually like getting red light therapy out into the natural environment in the sun, like a place like Australia. You just need to cover your body. So that is like what I would always say, and I tell my mom, is like you need to check the UV rating, you need to check the time of day. Yes, when it's very strong, this is probably a time you want to stay under shelter. But if you do go out and you can't help but be out, and you're worried about getting burnt, I would use this special kind of silk. And this I feel like in the future, everyone's going to have this silk. They're going to see the sun. No, I don't want to use sunscreen, but I still want, I want to get the benefits of the red infrared light. I'll put this silk on, and you wear it sort of like a shawl, like
Right.
you know, but I would always avoid some sunblock. I just, unless of
Mm.
course it's a sunblock that's completely natural ingredients. It is something that you would put into your mouth, you would eat it. but I would just avoid it. It's just like where we are with in Australia, we're out of our, like, people that are fair skinned, they're out of their natural environment. We were 30 degrees away from the equator. We were in those sort of those northern southern regions, mostly northern regions. But now we've immigrated, we've moved over, all of our history into these very sunny environments where our skin, we're not conditioned for it. So it's everyone wants to live in beautiful, sunny, Australia is like one of the most beautiful places you can live. But I just don't endorse the solution of sunblock unless it's a natural substance. It's like coconut oil or something that you could use. I would, just say regulate your time out in the sun. Don't go too long. And you can actually build up your SPF level by using red and infrared light. That's another study people can research, is actually how red and infrared light can boost your body's overall protection against UV light. But don't use sunblock. There's this silk. I'm going to get this out on the market soon, and it's just something you'll have as your towel.
Mm.
But you just have a good relationship with the sun. Understand its power. Understand the fairness of your skin. What you can tolerate, what you can't, and practice daily sun exposure just in slow increments. Understand that red and infrared light does boost your body's SPF level, so you will be able to withstand more UV light in time with more red and infrared light exposure. But that's sort of my overall, after being in this sort of the community of scientists all over the world. That's sort of like our overall stance on it. We're just like,
Yeah.
avoid sunblock at all costs. Don't put a top
Yes.
on your body.
Yep.
It's not healthy. Mm.
And you have a vast experience in all sorts of activities, John. I've read somewhere that your athletic background spans from rugby,
Yep.
CrossFit to boxing, and dealing with the challenges that you've had to overcome. How did also those experiences shape how you think about recovery and performance? In particular, you were talking about a tumor, which is
Yes.
very,
Yes.
very, very difficult time for you, I guess.
Yes. I think back in those early days when I was competing, I was sort of like a yes man. You would just sort of, I would put my head down and just crash through walls, kick doors down, and I wasn't really I wasn't really a process calculated person. I was just one of those athletes that was sort of, and you're in a, like, especially on the rugby field, that all your mates, the culture is just like harden up and go, right? It's very much this. And sometimes sport can be like that, where you want to show your prowess, your grit, and how much you can endure. Whereas I think now, as I'm older, I'm 40 now, and I feel like, just having so much business to do, and working so much, I take a more calculated, processed way of living, and focusing more on recovery and well-being, and thinking more about the future. Like, I want my kids to be with a healthy father, one that can, play around with them, and climb a flight of stairs, and not be so broken from this early, time as an athlete, where you just wouldn't address your pain and your injuries. And I think the whole world is now like this. The whole world is now, recovery is the new thing.
Yep.
Recovery is the new talking point. Luxury is now where people talk about the amount of sporting events that they do, or their biological age, or, they talk about like all the little biohacks that they're doing. That's now the way to show your status. Like, Vegas now is having trouble because no one wants to drink excessively anymore. Everyone wants to go on these, these experiences where it's all about, meditation, about silent retreats, about like tech detoxes, drinking, special, herbs and teas. And the whole world is shifting like this.
Mm.
And I just had a bit of an earlier shift, because when the doctor tells you have a tumor in your head, you're like, whoa, it's not a fun thing to hear. And he told me, I remember he said, you have 11 months to plan the surgery, because the tumor is growing. and it's growing into your brain. And as it grows, it's going to be difficult for us to use this. It's called microsurgery, where they're able to get in and without creating like a huge gash on your head. So I
Yes.
did like 11 months to get it sorted out. But it's certainly something, I don't want this to come up again just because I'm careless and I'm thinking, letting my ego sort of run my training or run my life, right? I now am trying out this was it Hyrox, this Hyrox, this
Yeah, yeah, yeah.
I'm now, and this is fun because I can do like a team thing with my wife. Me and my wife, we do it together, and it's sort of something we can do to sort of grow our relationship. But that's sort of my thing for this year. I'm sort of like, how do I compete? And like, okay, Hyrox we'll give this one a crack.
Yes. Yeah.
Yeah.
And talk to me about Lumaflex, John. How does it differentiate from other red light competitors?
Most of our competitors still don't address portable devices. And I don't in any way say that, you shouldn't have a large panel at your home, or if you wanted to get one of those large cocoon beds. Absolutely. That's full body mitochondrial activation. That's like getting a mad dose of cellular health all in one shot. It's just that device will be location fixed. It's usually a bit pricey. Are you going to stand in front of a panel, and do your panel training, panel sessions every day? For me, I don't. I'm not going to have a panel on my door and then say, oh, it's that time of day. I got to go stand in front there. I'd rather have a device that I can lay on the bed right before I go to sleep, or as I wake up, I can use it, or have it at my desk that I can place it in different areas. So for where we are right now, like I don't see many other people interested in portable targeted pain management red light therapy. It seems like the beauty is taking over. It seems like that's where everyone's interested in. Like
Mm.
where I am now, where most of the manufacturing is done for red light therapy, everything is beauty. It's small devices, it's masks, devices sort of that complement your skin treatments and your lotions and everything. It seems like beauty is still what everybody's excited about. And people have asked me, like, why don't you do a mask and enter the beauty market and jump on this bandwagon of everyone wanting to get a mask? But it's just not it's not my skill set. I'm not too interested in skin rejuvenation solely. I'm more interested in pain management and medical and healthcare, and bringing the product in as a medical device and used in places like ambulances or used in clinical studies. You go into a clinic, I have this problem, I need to get fixed. I want to see my kids graduate. What do I do? And this is part of that treatment protocol. That's sort of where my passion is.
Mm.
But I just don't see many people interested in that. There may be, it is tough though. Like I must say, like it I work nonstop. Like there's no holidays. So it is like when you're launching this new sort of concept and you're positioning the product in that way. Yeah, you're the only one doing it. So everyone's like, what?
Yeah. Yeah.
It takes work, but I feel like eventually, other brands will jump on the bandwagon, and I want to raise the awareness of photobiomodulation in the world. I don't see competitors as in red light therapy products. I see competition in pharmaceuticals, in evasive means of medication, of people that see fast solutions like, oh, I will take a drug, I'll feel good, but that will catch up to you. It will catch up. You'll get to an age where it's like you're stuck. You have to have your pill, or you're nothing, right? Your identity is now a pill popper. And that's where the competition is fighting, the big beast of pharmaceuticals, the massive heavy marketing. Just take a pill and everything's
Yeah.
fine, and that's in America. These ads are nonstop. They're nonstop. And it's so like in your face, and you get influencers joking about it and creating memes, like, but it's exactly like that. The America as a country is very unhealthy. And that's why wellness is kicking off, is because as a country, it's really in a bad state. It's a state where, like you said, with processed foods, microplastics are now the big thing. Microplastics are now the new cigarette that we all need to watch out for. Um, and you've got terrible air. Air is another thing. If you live in Miami where you get good sea air, that's nice. But most of the regions where, like if in New York City, it's just the air pollution is terrible. It's absolutely terrible. Then you got Wi-Fi, where Wi-Fi is like something that is, yeah, that's some, I mean, everyone listening, look into fluoride, look into Wi-Fi, look into chemtrails, look at these, this is going into conspiracy theories, but this is something that, again, very, very bad for us. Not many people ground, like grounding. Do you ground? Grounding is, I think everyone in Australia grounds because it's just the culture, right?
Yeah, yeah, and grounding, if I'm mistaken, is the act of taking off your shoes and going onto grass, earth, sand. Is that
Yes.
right?
Yes. And it's like it really like it would be best if where there's a tree, like if you were to do it and hug a tree, because that's real grounding. Sometimes
Mm,
people have grass growing, but it's not real grounding. Where the grounding, the ultimate practice of grounding is going to a beach, like the beach and getting in the water. That's where you really ground. But grounding is something so simple. You can buy, like I have here, a mouse pad that's connected to the ground. That's my grounding. I have a grounding mat where my mouse pad is.
right.
You can buy grounding mats for your bed and lay it on the bottom of your bed so your feet are grounded all the time. And it's so
Wow.
simple. Oh,
It
so simple.
is.
But it's not many people even know about it or do it, right? But yeah, go to New York, nobody's grounded there. There's no one
Yes.
no one's touching the ground in New York.
Yeah. And John, I read that you opened 6 gyms and built
Yes.
multiple fitness technologies. That's
Yes.
unbelievable. That's amazing. And
Yes.
what were some
All
of the
failures.
lessons of those? What was that?
All
Sorry?
failures. Yeah, like to get into medical, to push into product development, push red light therapy came from a lot of failures in my business life. I was that guy that opened up a gym purely for passion. Like, oh, I love working out. I love the feeling of working out. I love training people. I want to build my own gym and just do this every day. But I wasn't very good at the business side. And I did bring on partners, to help with the business, the numbers. Let's keep the costs going. Let's keep the doors open. But by the time I did that, most of the gyms that I had were not very successful. I had to sort of let them go one by one. And like
Yes.
kudos to anyone who runs and owns a gym. It's really it's tough. It's really, really tough. Like you promise you're going to open at 6 o'clock in the morning, and then you hire staff, and the staff's like, oh, I'm going to go see my mother, or I'm taking a day off, and you're the one that ends up having to go open the gym, close the gym. So you're pulling like 16-hour days. It's very, very difficult. It was good, very good learning, really good experience. And you sort of you need to, you know, sort of track a bunch of failures before that's kind of like your learning in business.
Mm.
So I
Yep.
look back in the gyms and going into fitness tech to augmented fitness to blockchain fitness. I was part of founder teams that had visions, but most of the projects, it was during a trend like the COVID trend, or the crypto trend. And we were just late. We were late to market, whereas the big giant got out there, jumped on the trend, and now the trend is gone, So it's all good learning, and it's something I'm grateful for. But there was one time, like in California, there's the startup scene. There's all these sort of speaking events, and one time I was invited to an event called Fuck Ups, and it's all you go do is talk about your failures. And I was like, give me the mic, hold my beer, let me. And it's good. You learn so much. It's like going to university, like, yeah,
Yeah.
100 times over. You just
Yeah.
know.
And you're currently based in China, John, and a lot of your
Shenzhen,
products are manufactured in China. What have you come to learn about the culture in China?
China, yeah, China now. So the office in Miami is a sales office. There's an office in The Hague. That's another sales office. Production is China and Poland. I also have another production factory in Poland that produces, and that's the factory that sells to, that's GSA. So that sells it to the military. Um, but like I have a passion for the Asia market. So I've opened up distribution in Vietnam and in Singapore, and Japan and Korea are within the next 4 weeks. I'm going to take a trip over
Wow.
there to lock those distributors. But I believe China will be a good market, another large consumer market, just like the US. So I'm building a team here to tackle the Asia market. And because of coming in and out of China for manufacturing for so many years, I do have a lot of good resource here. I do have a lot of good connections that I feel could result in a very successful launch. And how I'm launching in Asia, which will translate to also launching in the UAE, in Dubai and Riyadh, Saudi. This region is also very exciting. Is I'm coming in with education. So education is it's sort of, we're almost more of an education company than we are a product company, because it requires so much education to talk about light therapy. So we started the academy. We started this Lumaflex Academy, and I've got a scientist on my team who's done all the coursework. And it's something that if anyone's interested in learning about light therapy, literally a zero to hero course, you just connect with me on Instagram, John Graham Fitness. Just say, yo, I watched the show, Unleashed podcast. Let's go. Here's my email. I'll get your email and I'll enroll you in the back end, and you'll learn everything that you'll need to know about light therapy forever. Like you're good. You'll understand the how it all works. But we want to take that academy, all those courses to another level. So I've submitted the coursework to ACE and to NASM, like these big education bodies, the American Council of Exercise, right? The National Strength and Conditioning, these big like education bodies that are in the US, and it's going to get accredited. So with that accreditation, Chinese and the culture of Asia in general, and the culture in the Middle East, they greatly respect education. So we're
Mm.
coming in to the markets as training the trainers. So trainers, therapists, doctors, nurses, all of them, they can attend a course. They get an a fully accredited certificate, and then they're empowered to not only be able to understand and fully use Lumaflex, but any red light therapy. They'll understand how it works, and then for their specific practice or their gym or whatever. But that's what I'm going to be here for at least 2 more weeks. But that's the big hustle that I'm
Mm.
focusing on now, is
Yeah.
preparing our accreditation launch, which is that's really exciting. Like I had a
Yeah.
milestone getting into medical, I had a milestone of getting into the military, and now the milestone is accreditation. First ever red light therapy accredited course in the world that's
That's
ever happened.
fantastic.
Yeah, I'm
Yeah.
hella really excited.
Yeah, and I love how passionate you are, John, about this. And by the sound of it, you're making a massive impact, mate. And it's just so good to see more and more people that are diving into entrepreneurship and discovering the power of healing and
Yeah.
natural remedies. Because we are, mate, we're in a sick society right now. Obesity has gone through the roof. Mental health has gone through the roof. And it's just good to see, mate. It's really good to see. If someone was to listen to this conversation, John, what would you like that person to walk away from,
You
knowing
should.
what you know?
Yeah, if anyone listening, please do your own research on red light therapy. Of course, if you reach out to me, I can give you access to the education. I can give you access to all the clinical research, get you excited. But go easy and just go onto YouTube, type red light therapy, what is it? And just start watching videos. And the goal really is for I want to get people excited about red light therapy. I want them to get excited about, wow, like my mother has this condition and I want to help my mother. My son is playing in playing soccer. He's playing league soccer, and he has an injury. I want people to see red light therapy as a solution for these problems, right? Not because people sit there and they kind of are like, what should we do? Should we do this? There's multiple things that you can do, but red light therapy is the ultimate health hack. It's
Mm.
cellular energy. It's simple, easy. It's not made in a laboratory with a bunch of wacky scientists, that do these, mumbo jumbo with these LEDs. It's all from the sun. It's not like, will there's zero known negative side effects to light therapy, right? It's
Yep.
not. I, of course, in my manual, when as Lumaflex, as a CEO of Lumaflex, with my Lumaflex cap on, I always say, don't use if you are pregnant, don't use if you have a heart condition, consult a doctor. I have to say this, for liability and as a medical product. But if I take off my Lumaflex hat and I'm with my, light therapy scientists, I say absolutely use when you are pregnant. Absolutely use when you have a heart condition. Like, I'm very passionate about that, and I want people to get as passionate about it too, because there's so much that you can, so much you could do in your own lives and with your own family and friends. I had a lady that I'll never forget. I was on a plane. I was flying from Chicago to Miami, and I had the Lumaflex on me, and I was sitting next to this sweet old lady, and she was like, "What is that? Why is the lights, and what is that?" And we were talking, but the whole flight I was talking to her, and she goes, "Okay, yeah, I want to buy one." And she got one, and she gave it to her sister who had this very, very serious condition, and she wrote me an email after, and she said, "John, I think it was a miracle I met you." And I went, this sort of like things like that, those sort of times when these things happen, it makes me really like, yeah, this is a good mission. This is an exciting business to be in. I don't like, it's not about the money. It's about having people write emails to you and say, it was a miracle I met you, because it makes me,
Yeah.
gets me very emotional. It gets me very excited. Right. So
Yeah.
anyone I really want to share that and make sure everyone gets excited about it. Just go to
Yeah.
YouTube, start researching, and just go down the rabbit hole. It's a fun rabbit hole. There's lots to learn. Yeah, and the ultimate hack that you can really service your every condition in your body on a cellular level, and it can be free from the sun as long as you know how to regulate it. It is free. It is
Yeah.
available to us. Right.
Yeah. John, what would be your advice to aspiring entrepreneurs that have an idea, they don't know how to start a business, they have no formal background about marketing or anything like that? What are the steps? How do they go from point A to point B?
I th- I remember I was asked at some conference this question, and I don't know if this is a good answer, but it's like the only answer I got. And I retired in Thailand for a period of time. And while I was in Thailand, I got into bodybuilding because there's no impact in bodybuilding. There's no like, when you compete in bodybuilding, you just basically diet. Like, it's
That's
all the
right. Yeah.
bodybuilders that make it sound so hard. Like, come on, guys. It's just, deal with your emotions. Don't eat your cookies. But yeah, anyway. But I did 4 competitions in 7 weeks. I did like a really hard grind. Like, I was like, let me see how this goes. And I remember at the end of the competition, I was like driving back. I lived in Koh Samui, so we had to drive to the ferry to take the boat over. And I was thinking about sort of my philosophy, what's my motto, my life motto. And I think basically what it comes down to is, if as an entrepreneur, I don't like the word entrepreneur because it kind of could be misused. Like, someone with OnlyFans can be an entrepreneur, right?
That's
But
right.
you
Yeah.
want to be a visionary, and a visionary it's like a sickness you have where you want to do something that impacts the world. If you have this little sickness where you're like, I want to do something that means something, that changes something, that makes people's lives better. If you have this little thing, it's like you're a visionary, right? You're on a mission, and you kind of have to see life in 3 stages. And if you can kind of crack this code, then all of the issues of where do I start, how do I market, how do I get noticed, is this important, is this a problem that I am providing a solution to, how do I vet my solution, all of that sort of grind work, you can get through it if you see life as like, basically, we as humans challenges are something that is part of the human experience. It's just there's nothing's free. We're not like on beaches having, sipping pina colada. Like this reality. Maybe if you see it on social media, how people driving in cars or going, in private jets or whatever. It's not, that's all fake. What the reality is there's challenges that you have to. Level one is you accept that life has challenges. You get kicked in the dick, and you have to pick yourself up and be like, I have to accept it. Everyone's dealing with this. So the first level is accept. The second level is where you appreciate challenges, because every time you overcome a challenge, you rise up higher, right? So you gotten injured, or your first business launch wasn't successful. You appreciate this learning, because then it means that your avatar in the game of life has gone to the next level, and now you're ready for more success. But the God mode, if you can crack this, is when you don't just accept or appreciate, but you look for challenges, because you see this pattern in life where every time you have a low comes a very big high. So you hack this and you go, wow, every time that I face a challenge and I overcome it, I rise up higher. So I'm going to train my thinking, train my focus to actually look for challenges, because in the game of life, my avatar, I want to level up faster. I don't want to level
Mm.
up over the course of 20, 30 years. I want to do it in 5 years. And the way you do that is you just challenge, you look for challenges, you get excited and you want to challenge yourself. And that's kind of my accept, appreciate, look for is kind of my overall philosophy for someone that is saying, I want to be an entrepreneur, or what I prefer to say is a visionary, someone who wants to impact the world. I just say that's kind of your day-to-day system. How do I challenge myself? How do I look for a challenge every day and appreciate it, overcome it, and then repeat next day, repeat,
Yeah.
repeat. Yeah. Does that make sense?
And it does, it does. No, you articulated that beautifully, John. And I guess too, with regards to entrepreneurship, my cousin, he made a very good point. I asked him, I said to him, so he's the founder of Clean Health Fitness Institute in Sydney. So he's from
Nice.
Sydney, but now he's in the Gold Coast. It's the largest online fitness education platform. And I
Amazing.
said to him, John, I said to him, what's harder, your first 100,000 or your first million? He paused and he said, that's a fucking great question. He
Yeah.
said, your first 100,000 is the hardest. Your first million comes from the repetition and the failure and the setbacks and the obstacles of making your first 100,000. It's doing it over and over and over again
Yeah.
until eventually you get to that desired outcome. And I loved how you were just saying that just before, John. It's about the obstacles that you overcome, you're learning from your failures, you're learning from your setbacks, and you're able to rebuild that into that avatar that you're looking to become.
Yes.
And that was a
Yes.
really good breakdown, what you just said.
Yes. Yeah. If you've
Yeah.
only at the level where you just accept challenges, you're kind of like, fine, whatever, right? And you kind of get stuck there. You kind of like maybe even get into a loop where you're like, oh, okay, fine. Well, I'll just accept everything bad that happens to me. But if you change the energy of your life and you start to appreciate it, then you kind of like you overcome it. It's like the failure isn't as bad, and the jump goes higher. And
Mm.
it's like your own energy, the energy that you have. There's this energy of the energy of abundance or the energy of scarcity. You
Yeah.
find people that are always the victims, and they're always like, poor me, poor me. Then you have the people that are always in a state of abundance. They're always creating this state of abundance in their minds, and then greatness, success always goes towards them, because they're always in a state of, I'm fine, I've got everything I need. And then the universe, you could say, kind of just rewards them, right? That's kind
Yeah.
of
Yeah. Yeah.
I try
I
to do
tell you
this.
what, John, I could talk to you all day, mate, about red light therapy, health, fitness, education, nutrition. I just find this topic is so fascinating, so interesting. And whereabouts can people find you, John? Are you on Instagram and social media? Like if they want to
Yeah, yeah.
maybe purchase some of your devices, your products, or read a little bit more into it?
Yes, please. Yeah. John Graham Fitness is definitely the best to reach out, because emailing, like, I try to get office hours here and there, but sometimes I'm just on my phone and it's just easy to, it's easy to jump into a chat. Anyone listening, reach out. I'll get you access to the education if you're interested. Obviously, discount codes and everything. That's for sure. But yeah, the education is definitely a great place people can start. Just to get excited about it. I have a son who has this issue. My grandfather has this issue. My dog has this issue. Like, pet health and red light therapy. Wow, that's another
Oh,
whole.
that's
That's
interesting. Yeah, I didn't even think of pet health.
yeah, it's
Yeah.
huge. We've had dogs that have canceled surgeries because they use a Lumaflex. Like, it's that we have a racehorse in Poland that uses red light therapy. A race, like, equine care is, wow. That's,
Wow.
yeah, it's
What
amazing.
about
It's all
children? What
energy.
about
Yeah,
children, John? Yeah.
yeah. Like, I would that we say, like, you don't use under the age of 18, but like, if you read the clinical research, a newborn baby can have red light therapy. A newborn baby, like like, when I have my child, red light, like, trust me, I'm gonna have, like, its little crib. I'm gonna fix it with red light therapy so it can
Yeah.
sleep in red
Yeah.
light
Yeah. Yeah.
therapy.
Amazing, John. John, thank you so much, mate, for jumping
Thank
on.
you.
And yeah, I could talk to you for hours about this topic. But yeah, so you're on Instagram and you're on Facebook. Do you have a YouTube channel or
YouTube, Lumaflex. We've got a YouTube channel,
Lumaflex?
Lumaflex.
Okay,
Yeah,
so
yeah.
they just search for Lumaflex.
Yes, please. Yeah, yeah. Yes,
Yeah.
all the
Yeah.
no. Thanks so much. I really appreciate it. Great to share. I get
Yeah.
excited when I talk about this stuff.
I love it, mate. I love
Right
the
there.
I love the passion. I love how passionate you are about this topic. And yeah, it's just so exciting and interesting.
Yeah, thank you.
Yeah.
I hope everybody learned
Awesome.
something.
Thanks, John.
Cheers.